Hey everyone, thanks for joining me today for Scott's Analytics Angle. My name is Scott Everett. I'm the Vice President of Healthcare Solutions with Practical Data Solutions. It's been great. We've been out to the spring conferences this year. It's been awesome just visiting with a lot of you at these conferences. And what's really been nice is just seeing the change in energy that's out there. As we've met with people the past couple of years, there's really kind of been I'm just trying to survive another day. But that the energy that we were feeling this spring at some of the conferences we went to and places where we were presenting, you can really feel the energy back in the room. You can start feel that people are really ready to get back to running a business, really back to wanting to focus on the strategic areas of trying to grow their business, trying to figure out ways to improve what they're doing and provide care for their patients. And really a lot of them are really looking to put their financial house in order. And I think that's great. And so that's what we wanted to talk a little bit about today on the analytics angle is some of the top revenue enhancers and cost reduction strategies that you can look at. A few years ago, we did a webinar on driving revenue to the bottom line. But what we talked about is ways that really in any business, there are ways that you can increase your revenue. And three most common ways are you drive more volume, you get paid more for what you do, or you get paid faster. And so we wanted to talk a little bit about that today and how we can apply that in a healthcare setting and talk about some of these strategies that you can incorporate to really drive bottom line revenue that way. So let's talk a little bit about volume. Now, in healthcare, we're a little bit different, obviously. We can't just make and sell more product that's out there. We're dealing with human lives, we're dealing with patients, and really a lot of that's even out of our control because we deal with networks, we deal with enrollment. And while we can put forth some, marketing efforts to try to drive more patients to our practice, we can start looking at patient experience metrics and scores to try to show how we're a high quality organization. We can start looking strategically at, expansion into underserved communities or looking at adding new specialties or recruiting new providers, things like that. A lot of times those take a lot of time and ramp up and it can be difficult. And even then, if we do drive patient volumes, we have to be able to fit them in with our provider schedules. And a lot of people I talk to say our providers are working as hard as they can. Their schedules are completely full. We don't have a lot of area to increase things. And so what ends up happening when you're really trying to drive volume is you put forth a lot of effort, a lot of stress, and try to drive organizational change. And what you're really gunning for is results that aren't guaranteed, or if they are guaranteed, it takes a lot of time to ramp up to where you want to get to. So when we think about patient volume, then what if we change the way we're thinking here and look at it not so much as seeing more patients, but what if we got paid for more patients? I'll tell you what I'm talking about. About 10 to 20% of the services that most healthcare organizations provide are denied by the insurance. And so when you think about it that way, you look at it and say, there's a big opportunity that we're just providing for no reimbursement that's out there. A decent percentage of those are our fault as well. So when you think about it that way, if you look at your preventable denials, the ones that we really could have some impact on the front end and look at reducing those denials or look at where we can recover where we don't prevent. And if you take all of that and say, okay, let's just set a goal of doing that for, half of our denial rate. Well, all of a sudden, what we've just done is we've increased our patient volume that way by 5 to 7%. I mean, think about it that way. That's really impressive to say you can do something on your end to increase your patient volume 5 to 7% without putting a lot of burden on your providers to see more patients or try to cram more patients in without having to invest a lot of upfront capital in recruitment or strategic expansion, construction efforts. You can drive 5 to 7% just by changing some of the ways that you do things on the front end and on the back end. That's a great way to drive volume within your organization. So the next one that we like to talk about is getting paid more for the services that we do provide, improving reimbursement. Now, here's the problem with this one. This is challenging in our environment right now. Obviously, we had Medicare making some cuts to their RVU conversion factors this year. We had commercial payers who tend to follow suit of whatever CMS does. It's really difficult contractually to try to drive increases in reimbursement in this environment right now. And then, of course, even when you're looking at it with more and more payers coming online with value-based care initiatives that change the way you get reimbursed, or quality incentives that come through looking at shared savings plan, or even if you are on a strict RVU modification or modifier conversion factor basis, that can be really difficult to model when they're making modifications to the calculations that are out there for these RVUs. And so really trying to change things contractually, trying to change things through the political process, that can be really difficult. So again, we got to try to think and look at this a little bit differently and ask ourselves, we would really increase reimbursement. What if we simply got reimbursed what we're supposed to get reimbursed? Okay. Obviously, when we think of this, we know we have some payer errors that are out there. A lot of times there are system errors from the payer. They'll approve the wrong amount. And a lot of times if you don't catch it early, it becomes a really big problem on the back end, trying to get that fixed and trying to get reimbursed what you were supposed to for those ones that have previously been already adjudicated. On the other side of things, you also have patient costs where you have high deductible insurance that you're dealing with. You have high co-insurance that you're trying to collect. You have co-pays that you're trying to collect. And really, if you're not doing it at the time of service, it drives a lot of issues that are out there. So if you can focus your efforts on time of service collections, when your patients are there, patients are engaged, it can really help you. When you shift everything to the back end, what happens is you have unpaid copays, which a lot of times are just getting written off the small balance write-offs. You have unpaid co-insurance or deductibles or estimates and things like that, which you have to spend a lot of time and effort on the back end tracking down the patients, trying to get them, trying to improve contact information. A lot of that ends up in bad debt. But if you can collect it on the front end as much as you can, that's really going to improve your overall reimbursement rates that are coming through. And then, of course, let's get back to denials. Okay. We talk about denials a lot of times where we talked about those denial rates, but when you look at it as well, a common statistic that I'm seeing nowadays is about 60% of those are never resubmitted. 60% of those are just written off. Oh, well, we're not going to work them on the back end. So that's a big opportunity that's out there where, again, a lot of these are recoverable denials. And so if we look at the reimbursement that comes through on denied claims, it really is just a fraction of what we get on clean claims. When you look at it, clean claims, you may get 55, 60% of billed charges, whatever you're at. But when you have denied claims, you're lucky to get 15 to 20% of your billed charges that come through. And that's even with fairly efficient recovery efforts. So looking at prevention is obviously the biggest key right here. If you can prevent those denials, get them through clean, they pay what they're supposed to pay, and you're good. You don't have a lot of effort on that end. But when you can't prevent them, really focus in on your recovery efforts, and you'll find a significant reimbursement return on investment that comes through on those prevention and recovery efforts. So the third area that we talk about is getting paid faster. And obviously, this is a big one in healthcare. Now, I always tell the story about when I was in grad school and I had the professor that made us write for an assignment 100 times, cash flow is king. And, it's kind of funny to think of a graduate school professor doing something like that, but it really kind of sets your mind on the importance of really what's it mean to have cash dropping to the bottom line rather than simply having it sitting out there as a receivable. And so the way I like to think of it is looking at all of the lags that are out there in healthcare. We have charge lag, or the time it takes the providers to get their charges in coded to the billing office. We have the billing lag, is the amount of time it takes to get input into the system and go through whatever front end edits that it has to go through before it drops to a claim and gets submitted. We have an insurance lag of how long it takes the insurance to process it, make a payment, get back, and then whatever back-end collection processes you have on that. So there are big lags that sit out there in healthcare. And the way I like to think about it is if you can reduce any one of those lags by 1 day, this year you will collect 366 days worth of payments rather than 365. Okay. That's just the way it works, because you'll have one that was moved up from next year, comes in this year, you dropped more to the bottom line. Okay. And that really is a critical piece right now at a time where we're valuing cash so much, is getting that in. Obviously, if you can find more ways to reduce these lags in each of these areas, each day that you reduce those lags is another day of payments you're going to collect this year. And that can be a significant cash benefit to you. But again, the problem that you have is it requires process change to get there. And so when we look at it, some of the things that we need to do to keep it from being really stressful is, instead of just trying to get all of our providers to drop a day of lag, look at your outlying providers. Look at the ones who are below average of their peers in their department or their specialty or their clinic. Look at those ones who are below average and work with them to help drive them up to the average. And so really that's going to drive a significant number of days for a handful of providers, which overall is going to help you get to that 1 day reduction that you may want in that charge lag area. Again, look at time of service payments like we talked about in reimbursement. Anything you don't have to collect on the back end is so much slower. If you can collect estimates of deductibles, if you can collect copays, if you can collect even just deposits on certain procedures that you're getting at the front end, it'll reduce a lot of things that you have to do on the back end. It'll cut your bad debt down, and it'll help, again, drive that bottom line cash to your business rather than having it sit as a receivable a lot longer. And then here's our old friend denials back again. Let's talk some more statistics on this. Clean claims are usually paid in somewhere between 21 and 35 days. Okay. Denied claims take on average about 35 days to get back as a denial from the payer. It then takes a organization another 18 to 20 days to appeal and resubmit those. It takes another 23 days for the insurance to process it, send it back with a payment or another denial. And then, of course, you've got another 8 to 10 more days on the back end of follow up for whatever wasn't paid by the insurance. So when you think about it, the issue that you've got when you've got that many lags, additional lags coming into play with this, timely filing is going to come into play, which is going to make it so that you just can't get reimbursed for it. Or if you think about it this way, 21 days clean claim, about 90 days denied claim. You can see a significant lag reduction that can come if you can just work on preventing those preventable denials as best you can. So we've talked a lot about revenue enhancement, but obviously, profitability is the key concern. And whenever we talk about profitability, we have to talk about cost containment as well. And I know nobody wants to talk about cost containment because there's always a fear that whenever you talk about cost containment, that means we need to reduce staff, we need to reduce salary, we need to cut benefits. And really, right now, you couldn't do that if you wanted to. We're in a staffing shortage right now, and if you want to try to cut things like that, it's really going to drive some issues for your practice. Unengaged employees, I heard a speaker say at a conference this year, unengaged employees will leave your practice for $1 more an hour. And so if you think about it that way, really cutting salaries, that's not where you want to find cost containment in your HR area. If you really want to focus on cutting costs where it comes to staffing, look at your turnover rates. Okay. Turnover rates are driving a lot of costs in healthcare organizations right now, because whenever you have an employee leave, you have to, assume recruitment costs for finding a replacement for that employee. You have paid out accrued leave that comes from that. You have possibly new hire sign-on bonuses that come into play. All of that leads to much higher costs than you would have by simply minimizing your employee turnover rate. So having happy, engaged employees is something that can really help mitigate those costs. And in addition to that, having happy, engaged employees really drives patient satisfaction and patient experience scores as well. So really look at, focusing on getting your employees more engaged And that'll drive down your overall staffing costs that you'll find. Another way people are looking for cost containment right now is in standardizing procedures and automating where they can. We talk a lot about what we get from, the opportunities that came from time of service collections and just getting those processes in place on the front end, or looking at things that we can do to make ourselves more efficient from a throughput standpoint on the back end. But another place that people don't really necessarily look to see where there are opportunities is in automation of reporting. And that's something that really a lot of times requires a lot of manual effort for practices that are out there. We look at things like, productivity reports, compensation reports, financial statements, everything that needs to be produced on a monthly basis that has 3, 4, 5 employees working, consistently trying to get all of these done and out. Automation can really find a great savings from an operational standpoint for these staff who could really be better used in, ROI driving activities that are out there. So really looking to automate these processes as much as you can really help contain some of those costs as well. And then, of course, here's our old friend denials again. We did a study and it talks about denials cost about $28 to $35 to rework an appeal. And that's a piece. So really, there's a huge cost containment that can come from just prevention efforts, trying to get those things that are our fault contained and reduced to as minimal impact as we possibly can. And then even on the back end, when we're looking at appeals, we can find some cost savings by focusing our appeal efforts on what's recoverable. Let's be honest, there are some things that no matter how much we deny, we're not gonna recover that. But there are other denials out there that we do and can recover. So focus your efforts there, really kind of get as efficient as you possibly can on those recovery efforts. And that's going to drive your ROI, and it's really going to cut down your back end denial rework costs as well. So thanks for joining us today. If you need help with any of these areas, I know this is areas where a lot of places struggle. We do all of these things. We can help with all of these things. We can provide data and reporting to help you understand what are your processes, where are your inefficiencies. We can get actionable information into the hands of key stakeholders to help them make data-driven strategic decisions with regard to what more do we need to do from time of service collection effort? What do we need to do for reducing our lags? What do we need to do to make sure our payers are reimbursing at the levels they're supposed to be reimbursing at? PDS can help with all of that, and especially the denials. We can do a lot with denials as far as helping you categorize your denials for efficiency standpoint and rework. We can help you look at volume information for prevention strategies to find out where you're really getting hurt by which denials and which payers. And then we can also look at back-end transactional activity to help you understand what you're recovering and what you could do to more efficiently recover on these denials that are out there. So if there's anything that we can help with, we'd love to talk to you. Please feel free to visit our website at pds-online.com and let us know if there's anything we can help you with. So thank you all for joining Scott's Analytics Angle. Thank you.